Hi, I'm Dr. Chad Larson. Thanks for joining me in another episode of Keep It Real. In our last show, we talked about anxiety and how common anxiety is. Something like 40 million plus Americans suffer from anxiety. But the topic is even broader than that. If we include anxiety under the topic of negative emotional states, the number is much bigger. Countless people experience things like other negative emotional states like depression and irritability and anger and fear, and there's just these other negative emotional states that is not included in the statistics of anxiety of tens of millions. So who knows how many, but it's a very common set of symptoms that people suffer from. When I take these new patient intakes, anxiety is oftentimes on the list of concerns that patients are having, whether it's young or old or male or female. It's becoming a increasing problem. So last time we talked about 5 strategies that people can start to use to help combat these symptoms of anxiety. And the strategies that we talked about are certain breathing or breath exercises. That's number 1. Number 2 was decreasing blue light exposure that we get from things like our devices like cell phones and other handheld devices, laptops. They emit a lot of this blue light, and the blue light is at a certain end of the light spectrum that is quite stimulating for the brain, and it can be overstimulating for the brain. People who suffer from anxiety, it could exacerbate those symptoms. Number 3 on the list was improving your sleep pattern. We know that proper sleep could really dramatically decrease symptoms associated with anxiety. Number 4 was making healthier food choices. And number 5 was spending more time in nature. So this is such a common condition of these negative emotional states, including anxiety, that I thought I would, over the next few weeks, dive a little bit deeper into each of these 5 strategies. So today, let's talk about breathing and certain breathing exercises and what the literature has to tell us about studies that have been done to help us understand these mechanisms of how certain breath exercises can reduce these negative emotional states. So there was a study that was recently published just a couple months ago in June 2017 in Frontiers of Psychology, and what they did was they wanted to study how a particular breathing exercise affected actually a few different measurements. And they did one measurement. So they had a group of subjects, of participants, that here's what the technique was. It was 8 weeks long, and there was 20 sessions. So that worked out to be about every other day during the regular week. So weekends were off every other week during the week. And there's 20 sessions over 8 weeks. And each session lasted only 30 minutes. And the first 15 minutes, the participants just sat in what they called rest breathing or restful breathing. And so they'd just sit in a comfortable position and breathe normally. Basically eyes closed and just kind of a relaxed state. That was the first 15 minutes. And then after that 15 minutes, they'd go into deep breathing for 15 minutes, where they would do a deep, what they called a diaphragmatic breath, where the diaphragm really drops down and the lungs get fully, a full volume of air goes into the lungs, and then they'd breathe out, and they'd do this technique for 15 minutes. So 30 minutes altogether, 15 minutes resting and 15 minutes of the deep breathing exercises. And this was about every other day of the week for 8 weeks, a total of 20 sessions. And so they had a control group which didn't do the breathing exercises, and then they had the other half of the group which was the study group, where they actually did the technique. And then they compared the two, the control group and the group that actually did the technique, and they used 3 really interesting measurements to really get kind of a comprehensive understanding of how this technique affected the subjects. And here's basically what it comes down to. They used something called the PANAS. It's Positive and Negative Affect Schedule. And this is used in research it's like a self-reported questionnaire of the subject's state of mind, their mood, how they feel. And so that was one measurement of how the participants felt emotionally. And the second measurement was called the the NCT. It's a number cancellation test. And so basically this is a test for focus, mental focus. And what it is, it's a series of numbers and symbols, and within a certain period of time, the subjects have to evaluate certain patterns in the numbers. So it's a mental focus evaluation. And as a third evaluation, they did a neuroendocrine evaluation. They evaluated the levels of salivary cortisol, which is a very well understood measurement of stress. Cortisol is part of our neuroendocrine system, that when a person has very high levels of stress, which is very associated with anxiety, then they get cortisol imbalances. So they measure the cortisol at baseline, and then they measure the cortisol and these other measurements after the breathing technique. And basically, all three measurements improved significantly in the group that was doing the breathing exercises. So in other words, the state of health using the positive and negative affect schedule, there was a dramatic improvement of, in other words, decreasing the negative emotional states, and they had an increase in the positive emotional states. The number cancellation test, the test for focus, there was a significant improvement in mental focus after the breathing exercises, and likewise the cortisol balanced. There is an improvement in the cortisol number, the salivary cortisol number, in other words, decrease of the neuroendocrine system in people who did the breathing exercise. So that was a very significant evaluation, and with some really interesting outcome, and a pretty simple, 30 minutes every other day was all that was required to for the participants to experience these significant improvements. So that was that study. There's another study that's published in 2015, and there's lots of studies, by the way, on breathing exercises and emotional states. Some of these also include meditation, which is kind of mixed in with some breathing exercises. I tried to focus on just breathing exercises, and there's a bunch of different types, but that's what I kind of based my when I was looking for interesting studies on these. And so there's another study that was published in Applied Psychophysiology and Biofeedback in 2015, and what the research in this study really set out to evaluate was the neurophysiological effects of what really is happening with these breathing exercises, and how that pertains to these negative emotional states. And basically what it comes down to is people who are in these chronic negative emotional states like anxiety, there's a dominance of the sympathetic nervous system. Remember, the sympathetic nervous system is like the fight or flight, very kind of agitated, and it's a part of our sympathetic nervous system that is supposed to be firing just when we have the sense that we need to fight or flee, when we're in a certain circumstance where things are such that we either need to fight or flee. That's a sympathetic nervous system. It's a stress reaction. And the opposite in the autonomic nervous system of the sympathetic nervous system is the parasympathetic nervous system. In the parasympathetic nervous system, it's a relaxed state. And so what they set out to figure out was the physiological changes that happen when a person shifts from a sympathetic nervous system state to a parasympathetic, and that's really where they have significant improvement. And what they found out is when a person is in a parasympathetic dominant state, in other words, a very, very relaxed and a low anxious situation, there's a cardiorespiratory synchronization that happens. And so there's a heart rate to breath rate ratio, and for about every breath there's about 4 to 5 heartbeats. So when a person is in that ratio of one respiration for about every 4 to 5 heartbeats, then they know physiologically that's the state of cardiorespiratory synchronization, where a person is in that parasympathetic state. And they found that simple breathing exercises like the one we just talked about from the 2017 study really helps to bring a person to that state of relaxation. And what the researchers really emphasized, and I was happy for them to really call this out in the study, is that breathing exercises in a specific, way that could be prescribed for a patient should be really first-line therapy with these negative emotional states, because the current first-line therapy is medications, and the medications are highly targeted for like a specific neurotransmitter in the brain. But what we understand about these negative emotional states, it causes body-wide symptoms, not just mental emotional, but it can affect things like the gastrointestinal tract and other hormones in the system and our immune system. And these monotherapy pharmaceutical medications don't address the body-wide effect, but they notice that these breathing exercises do. The breathing exercises affect the whole body-wide system and not just, like a specific neurotransmitter in the brain. So they really suggested that we start to consider these as first-line therapy and really give these a chance with our patients first before we consider prescribing a medication that has only a very specific, targeted effect on a neurotransmitter in the brain. And frankly, there's much more potential significant adverse effect of the medications. We know that these medications have a pretty long list of adverse side effects. So it should be, first-line therapy. It's not difficult to teach somebody one of these breathing exercises, even if you're not, fully educated in how to do it. You just, there's lots of techniques. Just do the one that I just mentioned in the one study where, you relax for 15 minutes and you do the deep breathing exercise for 15 minutes and you do that every other day. That's 30 minutes. And that subject length, that research length was only for 8 weeks, 20 sessions. That's 30 minutes every other day, and 30 minutes out of 1,440 minutes per day, that's nothing. I think even the busiest amongst us can handle, putting aside 30 minutes every other day out of the, 1,440 minutes that we have in the day. So those are the studies that I wanted to mention on this topic. So I hope you learned something. I certainly learned kind of an extra level of understanding of these breathing exercises and how they affect the whole neuropsychology of the human body. So I hope you try that if you experience one of those conditions. And even if you don't, it's a really good, just kind of lifestyle thing that you could consider doing. It's not very time consuming. And so next time, we're going to continue this topic of working on these strategies for these negative emotional states. So next time, I'm going to dive into the research on how blue light can affect our symptoms of anxiety and other negative emotional states. So I'll talk to you then. Until then, keep it real.